Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM, and this cardiology seminars is brought to you by Triple N Media. On our YouTube channel, we have more than 200 cardiology lectures. We welcome you to watch those videos, and we also kindly request you to please do subscribe to our YouTube channel. The information provided in these videos is for education and entertainment purposes only and is not a medical advice. If you want me to research on a particular topic, I'll be more than happy to research and produce a video for your benefit. I also have a cardiology rotation manual consisting of more than 175 pages of pertinent information to enhance your learning on your cardiology rotations. It's good for nurses, medical students, residents, and fellows. If you would like to get a copy of this, please stay tuned till the end of this presentation, and I'll tell you how you can get a copy of this cardiology rotations manual. The featured presentation is on BLS, Basic Life Support. You may be in a grocery store, you may be in a train station, or you could be on vacation, or you could be at workplace. Suddenly someone collapses. What do you do? In order to address that, you need to learn basic life support algorithm. At the end of this presentation, you will be quite familiar with the basic life support algorithm. This is just the beginning. Of course, you have to take the basic life support training provided by the American Heart Association, but this forms the foundation on which you build your basic life support training. Here is an algorithm put out by the American Heart Association. It's very comprehensive and also complex. So what I have done is I have just taken just bits of these algorithm, broken them into smaller parts so we can understand this in a much more practical manner. So let us begin with this first section. When you come across a patient who is unconscious, what do you do next? So if you do come here, we're going to take this part. We yell, "Are you okay? John, hey, are you okay? I need help." You activate code blue. A lot of hospitals have this code blue programmed into the smart devices where you just go and press a button. It activates the code blue and it also notifies the location of code blue. So there are a lot of fancy advancements, but nonetheless, otherwise you just have to go to the right place and activate the code blue. Bring the AED and CRT cart. That's the first step. And once you have all this done, now we are going to go to the second step. The second step is, before we do anything else, we first look, listen, and feel. We are looking for spontaneous respirations. Does this patient have breathing? Is the breathing shallow? You pull the jaw up, so you extend the jaw so you can open the airways. You listen for airflow movement. If there's no breathing, you give 2 quick breaths. You take 10 seconds to feel for the carotid pulse. If you don't feel the pulse, we got a problem. So we need to make sure that we monitor the pulse. That should take 10 seconds. We attach the AED pads to the victim, monitor the rhythm, and based on the rhythm, we are going to determine what needs to be done. If the person has normal breathing and you can feel a good pulse, maybe this is not cardiogenic syncope, you monitor this patient and transport them to the emergency room. On the other hand, the patient is not having normal breathing, but you can feel the pulse. It could be a respiratory arrest. And in that situation, we're going to come to this box and see what we need to do. All right. Here is what we need to do. Provide rescue breathing. 1 breath every 6 seconds or 10 breaths per minute. Now we are talking about a person who has a pulse. The person is not breathing and we have a respiratory failure. So for this person, we provide 1 breath every 6 seconds or 10 breaths per minute. Check pulse every 2 minutes. If no pulse, then you start CPR. High quality CPR. I talked about high quality CPR in another video, and I'm going to mention that here also. Always think about these patients having overdose on certain drugs, medications or street drugs, and always be on the alert to administer naloxone if available per protocol. By this time, emergency response system or backup must have arrived, and you place an AED, get the emergency equipment, try to continue with the CPR. So this is the part where we focus upon their respirations. These are the patients who have pulse. All right. The next step is, what if this person is not breathing? And what if this person has no pulse? So we don't have respirations and we don't have a pulse. So the next step is we're going to go down here and look at what we can do. If the person has no respirations, if the person has no spontaneous pulse, we are going to give 2 quick breaths and start CPR. The high quality CPR based on 30 compressions. Make sure you compress 5 centimeters or 2 inches, and the hand recoils completely back, allowing the chest to expand. You continue these compressions without interruptions. 30 compressions, 2 breaths for a single operator. 30 compressions. You do it for 2 minutes. After that, you check for the rhythm. You attach the AED pads and you look for the rhythm. If the rhythm is something like VTAC or VFib, which is shockable, then we administer the shock. Once the shock is administered, what do you do next? This is an exam question. Now you have to remember that immediately after shocking the patient, you continue chest compressions for 2 minutes. You follow? Compressions for 2 minutes with the respirations. Because a lot of people say, well, I'm going to check for the pulse, or I'm going to look for respirations, I'm going to start an IV. No. Right after shock, you continue CPR. You see this sign here? Continue CPR. If you got a help, that person can check the pulse, can start an IV, and assist with the ventilation as it is needed. But if it's one person basic CPR, your job is to keep going. Okay, you get the message. If it's not a shockable rhythm, just resume CPR. 30 compressions, 2 breaths. 30 compressions, 2 breaths. 30 compressions, 2 breaths. So within 4 to 5 minutes, you should be able to get some extra help. So these are the basic fundamentals of BLS. Remember the steps, and you have to do them in the right approach, because the questions are going to be based on, after you shock, what do you do next? After you attach the pads, what do you do next? When you see an unconscious patient, what do you check first? So these are all questions you have to learn to pass the exam, so you better memorize this. Okay, ladies and gentlemen, that was a quick review of basic life support. On our YouTube channel, we have more than 200 lectures on cardiology, including most of the chapters on ACLS resuscitation. And please do subscribe to our YouTube channel. If you would like to get a copy of my cardiology rotations manual, please send me an email to drniknikam@gmail.com, and I'll be happy to send you a copy. And I would like to know if there's anything else we can add to the manual to make your learning experience much more useful. The cardiology seminars have been brought to you by NNN Media, and thank you so much for watching this presentation, and please do subscribe to our YouTube channel, and I will see you in the next video.